career in medical and health sciences. Uh, uh, Actually, it's a very, very vast topic, and I don't know if I will be able to do justice to this topic in the given time which I have got. Briefly, I would like to highlight to you what a career in uh, health sciences would be. Health sciences is a very broad topic, and it mainly includes the health of human beings, as well as research involving human beings, and to some extent even veterinary, that is the health of animals. So to start off with, uh, everybody needs to set a goal, because without a goal, it's very difficult to reach an end point. So goal gives us a starting point and a destination to reach. So, what is very important is for youngsters who have joined to listen to this talk, I would suggest that you start writing down your goals, so that the process of writing your goals help you to clarify what you desire to do, understand the importance of pursuing them, and commit yourself to making them happen. See, for example, even if you take a football match or a basketball match, first what is done is the goalpost is set. Without the goalpost, nothing happens. Similarly, even in our life, we need to set our goals. We need to have to pursue our dreams. We need to set our goals. So, what I suggest is that you write down your goals and keep reading it again and again, so that you get inspired, so that you can work towards achieving your goal. So one of the most important fundamental goals is that we seek pleasure, and we yeah, I would request all the participants to please mute themselves when they log in. So so the main goal should be the Almighty's pleasure and service to mankind. So beyond this is our dream of whether we want to become a doctor, a dentist, a pharmacist, a pharmacy specialist, pharmacologist. All that comes next. So the main goal, like I said, was the pleasure of the Almighty, and to please and help the mankind. There's a hadith of the Prophet which goes to say that whenever a sick person visits a sick brother, he walks along the path of paradise until he sits, and when he sits, he's cloaked in mercy. If he comes in the morning, 70,000 angels pray for him. And when he comes in the evening, 70,000 angels pray for him until the morning. So this is the importance of life sciences. Whoever is involved in taking care of people who are sick, the Almighty blesses them with rewards both in this world and in the hereafter. Coming to the actual reason why we are pursuing people to take up healthcare fields is because, see, there's a healthcare crisis in India. For the recommendation by the World Health Organization is that there should be one doctor for 1,000 patients, whereas in some places, on an average in India, it is one doctor for around 11,500 patients, 11,000 patients. Some places it's quite good, like in Kerala and some of the smaller states, but in the vast majority, especially the north, the discrepancy is vast. So actually, we are facing acute shortage of doctors. When there is a shortage of doctors, automatically the allied specialties also will be facing a shortage. So when you come to a career in medicine and health sciences, there are vast opportunities for you to uh, take it up. For example, uh, so medicine is the first branch: dentistry, Ayush medicine, allied health sciences, pharmacy, and nursing, and then veterinary. So basically, my talk is going to be based on uh, the following topics. So coming to medical admission, I would briefly touch upon medical because the first dream of most of the students who are pursuing a career in medical sciences or health sciences would be to join into MBBS. So it would be injustice if we completely ignore this medical admission criteria and the opportunities. So to start off with, I think the most famed entrance for medical admission is the NEET entrance examination, which is conducted by the Central Board of Secondary Education. And now it is uh, mandatory for anybody who wants to seek a medical admission in India to go through this test. So the basic criteria is that you should have scored more than 50% in your PCMB, and to score more than 50% of the cutoff marks in for general category students, and 45% for OBC and 40% for SC/ST students. So basically, the NEET counseling is divided into medical counseling committee, which caters to the 15% All India quota government seats, deemed university seats, and central universities like Aligarh Muslim University, Banaras Hindu University, Jamia Millia, and such universities, and the ESIC insured quota. So the main government quota counseling is done by the medical council committee, and this is for the all India seats. Since I presume that most of the audience is from Karnataka, my topic will be specific in some places with regards to Karnataka. So in the state university, by and large, all over India, it is the same criteria, but may differ from state to state. So in the state university, 85% of the government medical college seats are under the state government, and 100% of the private medical college seats are under this counseling for that specific state. So of late, there has been a huge number of seats which have been added up in the last 15 to 20 years. Now there are 692 medical colleges with around 91,000 medical seats, out of which 355 seats are in government colleges, catering to around 52,000 government seats, and 295 in private medical colleges, which offer around 47,000 private seats. So the fees from few colleges, fees ranges from 1,000 rupee, a few thousand rupees to lakhs of rupees, and it's different in different categories. So now, with the bond has become compulsory in many places, 1 year bond, or you have to pay up a small amount of money in some states, whereas in some states it may range in few lakhs. And more states are getting the doctors to sign bonds so that they can serve the rural population. Management seats, obviously 5 to 15% of the seats are reserved for private candidates who would like to take admission through management quota. So this is the basic framework of the medical admission all over the country, and specifically in Karnataka, you have the Karnataka Examinations Authority, which conducts the UG medical counseling, and the private medical colleges also allow direct admissions through the NEET score in the management quota, NRI quota, and various other quotas. Around 15% of these seats are reserved for the NRI students. So one more opportunity or option is to take MBBS in foreign universities. So there are a host of countries which are hosting thousands of Indian students who are doing MBBS there. It works out to be a little cheaper, and it has its own benefits and its own drawbacks. Some of the selected NMC approved and recognized colleges are good with good infrastructure, and English speaking countries are also there. You have to look at the safety and the comfort of living before opting for it. And finally, when you come back, this is the one of the major hindrances what many students have faced. The National Board of Examination conducts a foreign medical graduate examination. These examinations are mandatory for you to get a license and practice. But quite a few students have cleared this and pursued post-graduation and even super specialty in India. Now, looking at MBBS as a career option, like everybody knows that there are a lot of benefits, but it takes quite a long time to settle. But if you're focused and like I told you, if your goal is set that you're doing it for the Almighty's pleasure and for the service of mankind, rest of the things will follow. But your focus and long-term gains goal should be very well defined, because it takes a long time now with multiple bonds and entrances. Almost takes 10-12 years for you to establish. But still, rural India especially, and some of the tier 2 tier 3 cities lack even basic facilities. So if you're focused and if you have the uh, jazba, what they call, if you have the dedication and if you have the thoughts to serve the humanity, then definitely it's one of the top choices for any graduate who's pursuing a career in health sciences. So, like I told you, the sky is the limit. Post graduation, clinical practice, research, hospital management, and foreign studies. These are all options after MBBS. There is no shortage of choices for people who are pursuing MBBS. By and large, in all the health sciences, the career options get divided into three broad categories. First is, of course, clinical practice. Second is uh, most of the uh, options are career options are divided into this three opportunities. So this is how I would like to take you towards the future, how things will be in this field. So coming next to Bachelor of Dental Sciences, this again is a good option for people who have a long-term focus. Uh, Unfortunately, as the number of colleges and seats have increased over the past few years, the number of graduates also who have passed out in Bachelor of Dental Sciences has increased. Again, the admission is basically need based, around 324 colleges across India, catering to 10,000 plus seats. The course lasts for 4 years with 1 year internship, and then like some of the courses, because of the saturation, post graduation becomes mandatory, because people will want more and more specialists to be looking at them and managing them. So BDS is one course where specialization becomes a much sort of thing by people, because they're looking at people who are experts in that field. And for general dentistry, again, the especially in the tier one cities or the metropolitan, there's a lot of saturation. So maybe people who are planning to pursue this in tier two and three cities, general dentistry is still an option. Otherwise, post graduation becomes sort of an essential thing for you to establish a good practice or get into academics. So dental anatomy, oral pathology, prosthodontics. Prosthodontics deals with the making of what we call as the dentures, and so the bridges and crowns. Then there is operative dentistry, which deals with the accident and trauma and some situations with the malignancies of the oral cavity. Then there is orthodontics, which deals with the alignment of the teeth, and then there is pedodontics, which is pediatric dentistry. So these are the broad post graduations which are available. uh, like I told you, it is definitely a lucrative field. Again, with the long-term mm, uh, program and a long-term, sort of plan. Because again, 5 years and then again 2-3 years in preparation to get into post-graduation, and then 3 years of post-graduation. And as you do more cases and as you get more exposure is when you get more confident and in dealing with patients. Then coming to what we call as the Ayush, Ayurveda, Yoga, Unani, Siddha, and Homeopathy. This was almost like 10, 15 years back. They were all formulated into a different ministry, which was looking at the issues related with the alternative medicine or the Indian medicine, or as we call. And this is been now highlighted more and more, because we are looking at trying to push the Indian system of medicines, how it was before it was established in India. People are looking at it as an alternative, because a lot of people think that there is side effects and other issues associated with allopathic medicine. So almost like 1 lakh seats for MBBS, if you consider, we have around 50,000 Ayush seats. And there are around 900 plus colleges for Ayush, mainly spread throughout the country and concentrated in some of the rural areas. So there are around now 50,000 plus seats for you to vie for, again divided into two uh, categories: the central government institutes and the government quota 15% seats through the aaccc.gov.in website. That's the committee which does the Ayush counseling, Ayush Admission Central Counseling Committee. And then the state government quota is mainly through the KEA. Bangalore in Karnataka, sorry. So coming to uh, these are the three broad branches in which people get into when they want to become doctors. Now, medical field or health sciences is not confined only to doctors. It's an interplay of different teams. It's teamwork between doctors, nurses, and paramedical staff. So, as students, you should understand that there is a lot of scope and there's life beyond just MBBS, BDS, or these Ayush courses. And some of them may be more employable, some of them may be more challenging, and like I told you, the service to mankind may be more in some of these courses. For example, when you take nursing, I think the dedication of a nurse and the rewards what the nurse gains in the world and the hereafter is unparalleled, because nobody can take care of a patient like a nurse. A doctor can at the most give the orders and expect that the treatment is done, but the nurse, what she does, what the involvement with the patient is, it's a totally different uh, uh, scenario, and it's a totally the amount of dedication and what the patients feel with a good nurse is what actually makes the doctor's job easy and also successful. So we should understand we are individually, we are just a drop, and together we are in ocean. So wherever there is teamwork which is involved, the rewards and the results are also very large. So coming to the paramedical courses, so allied health workers, respected position in the society, they're a skilled workforce, more employability, opportunity to make them our ambassadors for the health profession, and it keeps them also in a safe environment within the hospital. And most of them in this day of layoffs and pink slips, these are all quite well guarded jobs. Like there is some sort of job security because you are gifted with a skill. So any job which has got a skill associated with it, there will always be a demand, and always there will be a employability uh, ratio is very high. So unless it is skill oriented, the courses will actually in the long run not be very fruitful. So the more skills you acquire, that's the reason the government is running so many programs, including the one under the Skill India program. There are hundreds of courses and to skill people so that there is a specific skill with them. So to give you an example of skill, if you consider the weavers, there was a specific skill associated with them. That is why they were so sought after. So everything in every field has a skill associated with it. So paramedical courses mainly concentrate on increasing your or enhancing your skill level. So they train you to become either a radiology technician, a lab technician, or a OT technician. So these are all skill associated courses. So coming to the qualifications and eligibility criteria, it's a post PUC 2 years duration, and post SSLC it's 3 years duration. So PUC is +2. So after +2 it's 2 years, and after SSLC it's 3 years. This is for the diploma courses. So the basic diploma courses are, like I told you, medical lab technology, X-ray technology, operation theater technology, dialysis technology, ophthalmic technology. There are another three courses which have been of late added into the basic diploma stream in Karnataka. One is the medical records, and the other one is health inspector. So there are another two, three courses which have been included in the basic diploma courses. So this is the diploma courses. Coming to the BSc, the options open up very vastly, because all the basic diploma courses have a BSc component in it, like radiography, optometry, medical lab technology, OT technology, dialysis technology. And there are other courses also in this, like cardiac technology and orthotics, prosthetics, public health. These are all additional BSc courses, which after the duration of your diploma course in paramedical, you have to add another 2 years for BSc. And again, like if you're interested in pursuing academics as a career, there is MSc and PhD following these paramedical courses. Lot of faculty in paramedical colleges are people who started with a BSc or a diploma and have now entered the faculty after finishing their MSc, and some of them even PhD. So, like I told you, clinical side is employment in the hospital. Academics is employment in colleges, and again, there will be a research option for people who are interested in getting into the research industry. So to highlight few of the courses, medical lab technology basically deals with the testing of blood and its various problems associated with blood, like you have blood counts and the lipid levels, creatinine levels. These are all components within the blood which help in managing the patients and treating and diagnosing their problems. Also associated with this is making of smears and biochemistry and microbiology, which deals mainly with the samples associated with the infections and urine and stool samples, etc. So you will be assisting senior doctors and senior people who will be identifying the diseases and who will be sending samples for them to be evaluated. Now, with more and more technology coming in, the role of lab technologists is mostly confined to identifying the challenges which the machines face, and trying to take out the errors from it, and most of it is automated. So it is definitely a very lucrative if you pursue the right sort of degrees in this medical lab technology. Diplomas give you jobs, but what secures you the real good opportunities and opens the world to you is the BSc. The bachelor's is what opens up the world to you. So you should be looking at, at least when you're doing a paramedical course, you should be looking at doing a bachelor's, even if you start off with a diploma, but you should not stop before a bachelor's. So similar to the lab, coming to imaging technology, which is a very very vast world today, and without imaging, many of the diseases remain undiagnosed, and it is paramount for the radiologist to have a good supporting imaging technologist, because they are the ones who are able to do most of this. The groundwork reporting is confined to the doctors, but before that, whatever is done, taking the X-ray, taking the CT scan, the MRI, everything is basically by the paramedics on imaging technology. Like I told you, the world opens up. For example, this is a job opportunity for MRI technician who have got this experience in MRI. There's job openings. This is just an example. So similarly, there is a paramedical course in dialysis technology. So a dialysis technician is a one who helps in doing the dialysis of the patient through this machine. The kidney specialist will suggest for the dialysis, but it is taken care by the dialysis technician, who spends hours and hours with the patients, because each dialysis runs to around 4 to 6 hours. So they are the ones who are there with the patients, ensuring that the machine can draw the blood and give it back to them. Again, it's a very skilled course, and it is can be done only with the dialysis technician. With the increasing number of renal failures in India and worldwide, and the longevity of patients, there is a requirement of more and more dialysis centers, which not necessarily will be managed by doctors alone, but by a team of trained and enthusiastic dialysis technicians. So there is one more course which has got a lot of scope, BSc in cardiac care technology. There is no diploma in this as of what I'm aware. So cardiac care technology, the technician is trained to do ECG, echo, and these technologists complement and work in tandem with cardiologists and cardiac surgeons worldwide. So again, very sort of department, and very challenging to get into top colleges. Most of these courses are associated with the teaching hospitals. Most of the medical colleges have these paramedical courses. There are standalone paramedical colleges also, and most of the admissions of this is comes under the paramedical board, and it is based on the PUC marks. It is not based on NEET or CET marks. So the PUC marks in PCB become the criteria for admission for these paramedical courses. In some of the courses, even the commerce students and art students are allowed to apply. Uh, so uh, Next is the cath lab technician. Again, there is no specific course for this, but the students who are pursuing a diploma or BSc in radiology, they can come into the cath lab and work with the cardiologists and vascular surgeons. To give you a small example, cath lab is the place where the heart attack patients are taken, and stenting and angioplasty, angiogram, all that is done. So these are the basic paramedical courses which are related more towards the clinical side. Coming to pharmacy. Pharmacy is a ocean in itself. It's a very old branch, and it starts with a diploma. Then there is a bachelor's, there's master's, and now there is something called as PharmD, which is a 6-year course in which the students are trained to assist doctors in hospitals in prescribing medications. Again, in pharmacy, there is a separate department which uh, board which deals with the pharmacy. So the Bachelor of Pharmacy is for 4 years and diploma is for 2 years. Academic requirement, like I told you, is +2 in science stream, and physics, chemistry, biology with 50% more marks, 50% and more marks. And the entrance, usually there's no entrance test. It is directly admission through the pharmacy board. Now, one of the most neglected fields, especially in certain pockets, is the BSc nursing. Whereas in certain pockets, like for example, Tamil Nadu and Kerala especially, a lot of students understood the requirement of doing a nursing course, and they're employed world over, because there is never going to be a shortage of nurses. Nursing basically involves a skill-based assisting to doctors and taking care of patients. And so there is a huge shortage world over, because the dedication what is required to do a nursing course is totally at a different level, and you need to have lot of empathy and sympathy towards the patients, and you should be feeling the pain of the patients to actually be taking care of them. So candidates should have completed 10th standard uh, with or plus two. For 10th standard, plus two is become mandatory now to get into GNM and BSc. GNM is like the diploma courses of the paramedical. So general nursing and midwifery is what is the full form of GNM. So with plus two, you can get into GNM. I have not taken A&M, which is for plus 10 standard students, because I hope that the audience here is definitely going to pursue beyond 10 standard, and it is going to look at least joining a GNM or BSc when they're taking nursing. So again, PCB, commerce and arts students with English are eligible to apply for GNM, whereas for BSc it is only the PCB students who can apply. And even National Institute of Open Sciences, those students also can apply. Open schooling, sorry, National Institute of Open Schooling students can also apply in certain states. That is the ones who are taking 10th standard in within the private this thing, they can also apply as private candidates. So again, in this also, nursing colleges also, there are a huge number of opportunities even on the government quota. So the counseling is held state wise. Fees ranges between 10,000 to 50, 60,000, even up to going up to a lakh. Duration for GNM is 3 years, and for BSc it is 4 years. Again, like I told you, BSc GNM is the basic course. You can convert it to a BSc by doing what they called as post GNM BSc nursing, which can be followed by post BSc nursing into specific fields. Like you can train into cardiac nursing, you can train into ICU nursing, and so on and so forth, pediatric nursing. And again, there is MSc for students who want to pursue a career into academics, and who want to get into more specific and niche areas. For example, there are many courses in NIMHANS, which is a central institute for psychiatric nursing and psychology and other fields dealing with the mental health problems and neurological disorders. So the opportunities of being a nurse, starting with a staff nurse in a hospital or a clinic, it can go on to administration, nursing superintendent, or into industries, department supervisors, ward sister, nursing superintendent again, and community health nursing. So for Karnataka, the admission is through the KSDNEB website, and it's all affiliated to the Rajiv Gandhi University. And the marks which are taken into consideration are the PCB marks, and based on that, you get the rank and the college is allotted. Again, the prospects are worldwide for nurses, and world over there's a huge shortage of nurses, and they are ready to take in nurses who are qualified with the required exams. And like I've just put up a advertisement in which Canada is needing trained nurses from BSc in nursing, which can convert your foreign degree to a Canadian nursing degree. After going there, you can pursue further education also. So always there was a shortage in Gulf, all as it is now. The world over, people are calling from even the Western countries for nurses to come and take care of their patients and cater to the shortage of nurses there. Then coming to physiotherapy, a physiotherapist, I hope that you all are aware. Basically, a physiotherapist helps in restoring movement and function when someone is affected by injury, illness, or disability. So physiotherapist works in tandem with a bone surgeon or a orthopedician in most of the places. But now with the advances and in the medical field, everybody knows that again a physiotherapist becomes a very important part of the of the care of the patient. In the team, physiotherapist is involved in early mobilization. That is, when a patient is admitted in ICU or when a patient is undergone a surgery, what the science has taught us now is that once the surgeon is done with his job, once the surgery is over, and once the patient is come out of the ventilator, or once he's able to move around, it is early mobilization. That is, we have to move the patient fast out of the bed. We have to bring them to a normal atmosphere fast. That helps in fast tracking the patient. That helps in sending the patient home fast. So the physiotherapists become very, very important there. And not only in patients who have just undergone surgery, even patients who are on the ventilator, though they may be on the ventilator, but they're conscious and awake, but because the respiratory problem is there, so they're being put on the ventilator. So these patients also, the exercises have to continue. Otherwise, their hands, their legs will become stiff. And after the coming out of the ventilator, they will not be able to walk and so on and so forth. That's why physiotherapy is a very, very important field, and many new diseases have arisen because of the new fields which have come up. Like, for example, 30, 40 years back, not many people were using the computers, not many people were confined to sitting for long hours. Now, with the advent of software and long sitting on computers, people are developing backaches and postural diseases, for which many of them can be treated only with simple physiotherapy, and it doesn't require any major intervention. So physiotherapists are in much demand. If you have got the the desire to help patients come out of their problems, and to help in their rehabilitation post surgery, occupation, there are so many specializations also which have come up in physiotherapy. Like, there is respiratory therapy, occupational therapy for children who are having autistic disorders and so many other disorders. Then there is speech therapy for children who are born with speech disorders, and even post-surgical speech therapy is required for people with oral cancers. So mainly it's a 4-year course with 6-month internship, 12th with science as background, and minimum 40% in PCB is mandatory. PCB marks for admission is required, not NEET or CET. So what I want to highlight to students is many seats, many courses are the admission criteria is not NEET. So though there might be so many students who do very well in PCB, but because they don't do well in NEET, because the exam pattern is totally different. PCB marks is based on the theory, which many students may be excelling in. NEET is based on the MCQs. So some students may have a shortcoming in taking marks in that sort of an examination. But they should not lose hope, and they should not feel that they are not worthy of anything. Whereas their PCB marks will be good, but repeatedly they will be pursuing NEET, which after 1 or 2 attempts they should consider that it is not their cup of tea, and there is world beyond just being a doctor. There are so many other fields which can help in taking care of the patients and leading a good and a respectable life. So the admissions are based through the KEA website, and it's affiliated to Rajiv Gandhi University. Almost 90 colleges in Karnataka, and 20% of the seats to government quota. And see the fees in the colleges. It is quite a minimum in the government colleges, and around 10 to 12,000 in the government colleges, can range up to 4 lakhs in private colleges per year. So like I told you, there is lot of scope for physiotherapists. This is a small example of a physiotherapist doing an exercise for a patient. So average salary ranges from 2 to 7 lakhs in some hospitals. Also, like, there is scope to do masters and getting into academics, and uh, there is scope for further specialization. Then possibly the highlight of my talk today would be to introduce to myself first and to the audience pure science courses, because pure science courses is always the it's associated with the STEM field. So whatever is associated with the science, technology, engineering, mathematics courses, they all have a worldwide appeal. So coming to the three broad subjects under which the pure sciences come is chemistry, biology, and physics. And with the practical application of this PCB, there are many courses which have been derived. And again, the jobs ranging from teachers, research scientists, quality managers, clinical researchers. There is scope for so much and to be done. And this is a very neglected area. But of course, these should all you should pass out from the top institutes, should pass out from the top colleges. Then there is so much of scope for employment. To give you a small example, bachelors in food science, they get employed as dietitians, food safety managers, production supervisors. Then there are medical physicists who complement cancer specialists. Like I was talking about imaging technology, in which there is a X-ray technician or a CT technician who does the background work. Similarly, for radiation patients who are undergoing radiotherapy for cancers, a medical physicist complements his job. So the planning is done by the doctor in sync with the medical physicist, and finally the radiation is delivered by the medical physicist under his supervision. So there are many courses in pure sciences. Like there's bachelors of microbiology, food science, forensic analytical sciences. Again, forensic analysis has become so very important in today's day and age when the crime rate has gone up so much, and there is a requirement of trying to decipher how and who has done the crime. And with the advent of technology like fingerprinting, DNA analysis, all this comes under forensic sciences. So you should look at these branches which are not so well heard of, but they are very lucrative branches, because the number of people also be very less in these branches. And marine sciences, biomedical sciences, like medical physics, these are all uh, pure bachelor's courses, and most of the bachelor's courses have become 4-year courses now, and the scope world over for these courses. So even the government has established a lot of universities dealing with pure sciences, and there are in IS, IISRs in Bhopal, Calcutta, Mohali, and so on. There is NISARs, which are high quality education and research in pure sciences. It's located in Bhubaneswar. Most of the IITs also offer pure science programs, and the world famous Indian Institute of Bangalore, with so many students from all over India and the world come to, is also well sort of institute, and many other colleges are there, and most of the degree colleges offer pure science courses. But like always, you should go with a passion, and it should not be that you got into pure sciences only because you could not get into any other course. So when you go with the passion and when you go with the dedication, definitely you will excel. And coming to veterinary sciences, though actually it cannot be called as a science dealing with medical science, but definitely even animals, as they're our companions in this world, they are also need to be taken care of, and there is so much to do in this field, and very few people actually pursue career in veterinary sciences. It itself, the demand itself is so less that there are hardly any private colleges. That is because people have not understood how much this field has potential. Once they realize, then there will be a lot of private colleges which venture into this department. So coming to Karnataka, there are hardly 6 government colleges and hardly private colleges. I could identify 2 or 3 only. and it's a 5.5 years undergraduate program with 1 year of internship. So totally 5.5 years. It deals with the diagnosis and treatment of animals. Again, students who have got minimum of 50% in their plus two with PCB as background, they are eligible to apply. And 15% of the seats are through NEET in the All India quota. So for NEET, this is a little confusing here. NEET is required for veterinary sciences for the All India quota, but for the state government quota, it is the PCB marks. And around 500 seats in 6 government colleges are available in the KEA website. Average fees ranges from 15,000 to 2 lakh per annum. Then the veterinary sciences opens up a lot of job opportunities, with being a basic veterinary doctor to a research scientist to animal breeders, officers, and now with the advent of what they call as pet parents. So there are some people who want to just have pets as their companions. They want to call themselves as cat moms and pet parents. So there is lot of scope in dealing with the animals. So the students should look at pursuing careers in veterinary sciences, so that these animals can be catered to. So, to end my talk, many people play a role in your upbringing and in your selection of your careers. Parents play a paramount role, and people around you. You should be surrounded by people who can inspire you in whichever field you want to pursue that career, and the place where you're located in. So, all these are important when you take a call on your career. So whatever our necessities, it's taken care by the Almighty. The desires of the life we should postpone for the hereafter. The whole concept of our life is that we should, look at not only our this life but the life which is coming in the hereafter. And so the purpose of our life should be ibadat, talim, khidmat, and dawat. So when you look at it, obedience and worship of the Almighty, learning and teaching. So whatever you do, you should do with good passion, and you should do with a good intention that you will excel in it. And you should do with the thoughts that you will serve mankind with it. So, and then of course, propagation of our beliefs should be taken forward. Not only is your career options selection of your career options confined to just looking at the courses, but you should also have the ability that once you have finished your exam, you should be looking at the scholarships, and you should be well aware of how you can try to utilize these opportunities available for you. And you should be available, you should be able to identify how you can get into the reservations system, which is confined and which is given to backward classes. It is available in all government colleges. So you should be exploring whether you are eligible for these reservations. And the basic thing, what I can suggest, what I could request you all is that you should not miss your 5 times namaz. Then Allah will pave the way for you. And whatever belief system you are following, you should be connected with the Almighty. And for us, namaz is the basic of our life. So as students, this is something which you should never miss, and you should pray to the Almighty to bless us with the best of knowledge. Rabbi zidni ilma, oh my Lord, increase me in knowledge, and knowledge which is beneficial. So we should ask Allah for knowledge that is beneficial and which will help us in carving out a career which will please the Lord, which will please the Almighty, and which will also help the us to serve the mankind and lead a respectable life. And after all, whatever the reward, it depends on the niyat which we do. Innamal amala bil niyat. The reward of deed depends upon the intentions, and every person will get the reward according to what he has intended. So I request all the students and the parents to make intentions that whatever careers we choose, we will choose with the purpose of pleasing the Almighty and serving the mankind. So none of you so we should keep ourselves away from social media, brainwashes us and it distracts us from the goal. And this is a very, very challenging thing for the teenagers, because at that time you're just liberated, and from being a child, you feel that you can be independent. But believe me, it's a very, very small gap which you have, maybe 14-15 years onwards to maybe 18-19 years. This is the duration in which the rest of your life, how you lead, will be decided. And here, if you stumble, here if you get distracted, the whole life you will regret. So here, if you are steadfast, and here if you listen to your parents, to your teachers, and you take up the challenges positively, and you do well, the rest of your life you will lead comfortably, you will be able to contribute, and you will be a force to reckon with, inshallah. We don't want incompetent princes who are playing video games and who think that they have achieved something in the life. A real battle is with one's own self, and we should control our desires and our thoughts. And even if you really have that in you, that you want to be on the battleground, then you take a career in army or navy or the air force and pursue it there, and not on the mobile phones and on the video games. And knowledge is the light which Allah Almighty blesses us with only the ones who are not sinners. So we should ensure that we are don't go astray and get involved in major sins, and we should always ask Almighty for forgiveness. So thinking and planning is, like I told you, is greatly influenced by parents and people whom we spend our time with, and places where we spend our time with. And we should ensure that even the parents, if they are attending, we should be aware of what all options are there for the kids. We should not pressurize them into just getting into a particular field, especially MBBS, because not every kid may be capable of excelling in that field. And you should keep options open for them. And we should ensure that we spend time with our whoever our peers are. They should be competent and very dedicated and qualified people in that field, so that we get inspired by them, and we should not waste our time. And of course, the places where we spend our time, it becomes very important. Like I've already mentioned, media and distraction should be totally avoided. So this is the selfie generation, which they come up only with zindagi ke chhe nishan, roti kapda or makan, biwi bache or dukan. So we should not be confined to just serving our needs, our requirements. We should look at the whole world as our companions, and starting off with our family. We should take care of everyone, and we should go beyond ourselves, and we should come up as a selfless generation. And what success is nothing what we gain or accomplish in our lives, but it is for what we do for others. So finally, trust your unknown future to your known creator. Have tawakkul in Allah. Inshallah, all of you will excel and do well. Jazakallah khair. So,
Jazakallah, Dr. It was very useful, mashallah. So, are there any questions from the audience? We are open for questions. You can raise hand and Dr. Saab will reply to you. Yeah, please. Sharikha Naz, you can go ahead. Sharikha Naz, you can ask your question. Okay, Dr. Saab, it's there on the chat about NEET towards MBBS.
On the chat box, I will just.
So it's about the NEET exam.
Can you about NEET towards MBBS? That broadly I have highlighted how it goes around. I'm not sure what exactly is your question. If you can specifically ask, like for example, There is a question. Zainab Fatima, she has asked if there's a physician assistant course available in Jaidava. Erstwhile, it was available, but of late they have, for some reason, they had discontinued it. But it is available in many other hospitals like Manipal, Fortis, Narayan Hrudyalaya, and even any person who's pursues diploma or BSc in OT technology and anesthesia technology, they will be trained to assist, or they can become physician assistants. So there are courses in Jaydeva. I mean, not in Jaydeva, other hospitals are available. Many questions will come, so I will be brief in the answers so that maximum students can gain benefit. I will take the questions from the chat box. How about courses for ENT? Yes, there is speech and audiology courses are there. It's a bachelor's course, and the courses are there in quite a few colleges. You can look into it. There is a government institute, which even in Mysore it is available. It is there. It's a very big speech and hearing institution. So there is opportunity for you to pursue courses in audiology and speech and hearing. Courses for optometrics, it starts off with a basic course in uh, diploma in optometry, and then you can do a BSc in optometry. These are also courses which are associated with the paramedical board. So you can uh, pursue that course. Uh, what I'll do is this email address. I'm not sure. I'll give you my personal email address. You can mail your queries in that also, and if possible, I will try to uh, get the answers to that, and I will mail you back for the students whom we have missed the questions. So then uh, optometry, yeah. Microbiologist, yeah, again there is scope for BSc in microbiology. Again, you have to maybe look at what exactly you want to do as a microbiologist. There is a lot of there will be parallel fields in this. There's You will be working usually under the microbiology person from the medical department. Like there's MD in microbiology, so they usually have you under them, where you will be doing a lot of sample preparation, etc., along with the doctor. So there is don't ask me the scope for a course. Even the person who has got first rank in AIMS, he can falter in his career. Just taking a degree or just gaining the skill is not the uh, prerequisite for a successful career. What I've heard from my peers and from my elders is that 20 to 25% is only soft skills. Rest of the thing, what you do out of your career, what you do out of your life is hard skills is only 20 to 25%. Rest of it is soft skills. So soft skills is how you utilize that degree, how you pursue it, how passionate you are about it. So long term results depend not only on what you have selected. Of course, there's scope for every field. Whichever field you take, there is going to be scope. Like somebody is asking, what about dental? Yeah, there is not much of shortage nowadays, because so many dental students have already passed out. But still, if you're interested, if you're passionate, if you identify where you want to put up your practice or pursue a good career in academics, there is a lot of scope in it. In fact, there were so many of my teachers who had come from dental background who went on to do MBBS in UK, because there to operate it was a prerequisite for them to become MBBS graduates before getting into surgical specialty. And finally, at the end, when they finished and started off their careers, they are now in the top surgeons in the world. One of them, in fact, was heading the world maxillofacial surgery society. So that was the passion he had. He was one of my close professors. You can Google his name, Moni Abraham Kuriakos. He was from Kerala, very, very dedicated person. So he had a background of MDS after BDS, and he went on to do MBBS after almost his marriage and kids, and came up to that level that he shined in the whole world. So what are the courses which you can I'm not sure about long distance D pharma, but these are courses which unlikely have options to be done long term, in the sense through correspondence. Most of them are college based courses. Courses which you can go for without need, yeah, there are most of the courses other than MBBS, BDS, and Ayush, you can go for without need. Paramedical, nursing, none of them require need. They just require PCB marks. If you excel in PCB, and minimum if you have got above 50%, you can take those courses. Molecular sciences, again, it's a niche branch. It's a very specific branch confined to top institutes like IISc, where there is scope in development and research of new techniques. Of course, again, you can pursue the branch in certain specific institutions. The criteria or the admission criteria may vary from branch to branch. B Pharma and Farm D, this is a very specific question. The Farm D, of late, it's a 6 years course, and they have been licensed to prescribe medications under the guidance of a medical practitioner. So they have certain specific advantages, and compared to the B Pharma specialists. Disaster management, I'm not sure about disaster management and need, because I'm not sure about the course which is associated with disaster management. Somebody is just asked ophthalmology. I don't know what you want to know about ophthalmology. I've informed about optometrics, so I'm not aware of what you exactly wanted to know. More degrees after MPT. Every master's is followed by a PhD. If you want to pursue a PhD, it will be there. It will be there in certain universities. You have to identify and get into it. Minimum marks varies from year to year. Every year, every state, every category has a different cutoff. So you have to look at which year you are looking into. Based on that, you will be able to identify. uh, for physiotherapy, yeah, you have to go through the like I told you, through the there's a physiotherapy board which will look into giving you admissions. So you don't need to as such have your neat marks for that. uh, yeah. Yeah, PCB marks is sufficient. I will try to share this PPT, inshallah. Anesthesia technician course, and admission was open for it till I think yesterday. In fact, there are some colleges which may still take students till 31st. You can mail me. I will reply to you back if it's open. Again, anesthesia technician course. It's if you start with a diploma, it's 3 years, and if it's post PUC, it's 2 years. That's a diploma course. Then you can do BSc. It is based on your PCB marks. How can Muslim girls? Yeah, see, one of the first Sahabia, if I'm not wrong, if she is Sahabia, Rufaida was her name, and she was the first possible nurse of our community who used to accompany in battles and help in people who are injured. We keep confining our thoughts to the practical problems, but if we get into those places, we will be able to solve them also. Of course, there are challenges. We have to sit with our elders and discuss on how that particular student can come out of those challenges. But definitely, there is a huge shortage of nursing staff, especially female nurses, because females will prefer to have been nursed by females. So these are challenges which we can discuss and inshallah sort out. I've shared my email address with you. My phone number also, inshallah. I will possibly I will just add it, but I will be available only on WhatsApp. You can. I will share it at the end of the talk. What are gastroenterologists? Again, you have to get your question right. These are uh, medical and surgical gastroenterologists. These are people who deal mainly with the uh, mm, problems of the intestine, stomach, the digestive system, liver. These are the organs which need a person who has done gastroenterology. Is BSc physiotherapist called doctor? Yeah, off late, because of the changes in the system, I believe they are conferred a doctor degree, doctor as a prerequisite in their name. But again, like I told you, many students unfortunately they do the courses to for the glamour, which I like. They will never be able to satisfy themselves just for the glamour sake when they join, because there will be some of the other shortcoming. So you look at other aspects than just seeing if a physiotherapist will be called a doctor. Better to look at if you will be doing some great justice to helping others. So physiotherapist prescriptions, unlikely. Over the counter drugs, yeah, they can prescribe. Healthcare IT, see, actually, since I told you it's a very broad topic which I was trying to discuss. 45 minutes, 1 hour is not sufficient. Already, it's about now 1 hour 12 minutes. So the attention span goes down. So to look at the topic which you have discussed, healthcare IT, I think that itself requires 1 hour, because now with AI automation coming into the healthcare field also, it's a huge domain which even I have not fully thoroughly explored. Definitely with the help of MFIRD, who have so many IT people with them, we can inshallah have a specific talk on IT and health in healthcare and IT, how we can highlight these courses to students. uh, the PG aspirant, see, I will try to, you can maybe message me. See, for example, there are certain uh, particular career guidance centers. See, this, what we do is, or what I have done is just out of my hobby and passion to highlight to you the broad spectrum of the medical and allied sciences. But by and large, the specifics you have to approach. For example, there is what I know of is there are many centers. One of them is Sigma center, which is run by one of our very close friends, Amin Mudassir Saab, where you can specifically go and discuss your problems with them. So you can identify these certain specific places wherever you want to go, where you can go and discuss with career counselors who can guide you as to what you exactly need to do. After pursuing BSc nursing, again, I know you as a nurse, you cannot open a clinic. Obviously, you can get attached to a doctor and you can work in association with a doctor. Courses for gastroenterology, there are a few courses which have now come up where post X-ray or post nursing, you can train yourself to help a gastroenterologist, in the sense who use endoscopes, colonoscopes. So you become a part of their team, taking care of their instruments and trying to help them to sort out their reports and doing the biopsies. So you can become a specific help after doing a basic paramedical or a nursing course. BSc Agriculture, sorry, it's not in the scope of health sciences. The course for cardiology I have discussed in depth. Uh, Cardiac care technology is available in many of the colleges, where it's a 4-year paramedical course where you're trained to um, do echoes and TMT, ECG. These are specific things. Podiatry course, I'm not aware. Again, post BSc nursing, many nurses can get into a short-term 6-month fellowship or 6-month training courses where they can get trained into podiatry. Uh, Female dentist, again, this you should ask with the ulema. It's something which is to deal with possibly fiqh, which I'm not, I'm not eligible to answer. In fact, MSET coaching, not aware. BDS in NEET, again, look at every year the ranks change and every year the cutoffs change. Okay. Biomedical engineering, yeah, that's very interesting. Uh, it is a B course available for students who have passion to develop the machines which are used by the doctors, like the CT scan, X-ray, MRI machines. You have to get into specific centers after you pass out, like GE Health, Siemens, and Philips, and all those sort of places. Again, you have to have a long-term approach to this, because many of them may not get employed right away. Maybe you have to do MTech and maybe even PhD to land up into good jobs. But again, if you're interested, the scope is vast, because in the ever changing world where technology is driving results, biomedical engineering has a lot of scope. Yeah, why not? You will be able to work as biomedical engineers, I presume. Psychiatrist, it's post MBBS, MD, or a diploma which you have to do. So you have to become a doctor first, then you will go on to become a psychiatrist. Okay. What therapists are you talking about? Okay. Sir bhai, I'm just sharing one number. If anyone wants to ask me something or something which I've missed, maybe if they want me to even find out and tell them, I can get back to them if they are able to WhatsApp me on this number. And like Saib bhai has said, it's available. This PPT is available on the link which he has sent.
Jazakallah khair, Dr. Sam,
Yeah.
for such a nice and useful session. So I would request all the audience to not to disturb Dr. Saab too much, because as we know, he's a cardiac surgeon as well as an academician. So he's extremely busy, and we need to respect his time. Hello. Lots of information is available online. So I would request all of you to please check the most possible detailed information online, and only on a very emergency basis as we contact the doctors. So he is very uh, passionate to help all of us, and he has shared his email ID as well as his phone number. But we know how busy a cardiac doctor is. So I would again request all of us to please don't disturb him too much. because lots of things you can get online, inshallah. So thanks a lot to all the audience, and Jazakumullah khair, Dr. Saab, for taking out your valuable time. And inshallah, as you said, this was not enough to cover the subject in total. So inshallah, we'll have further sessions from Dr. Saab to share his vast knowledge with us. So with this, we close this session. Is that okay, Dr. Saab?
Jazakallah, Saib bhai, for giving me this opportunity.
Saib sir, can I add one point here?
Ji, sure, please.
Okay, so my name is Imtiaz Ali. I am head career counselor for Telangana Minority Residential Institutions,
MashaAllah.
Hyderabad.
Ji,
So through Latif sir, we have received this your link to join this orientation information. What you have shared is really helpful and appreciated, sir. Why? Because in our institutions, you know that the below poverty people, the boys and girls from fifth intermediate. So we have been running this institution to give the best career to our students. Especially this is minority residential. So the maximum students are belongs to Islamic, Muslims. So this is really a great effort from yourself and your team, sir. This is definitely if a single student get a benefit, and if he become or she becomes in a big position, definitely this credit goes to you people, that you people come forward to give this kind of orientations to us.
Jazakumullah.